Congratulations! You've reached the final stage of your pregnancy journey. The anticipation of meeting your little one is truly exciting. As you approach your due date, your body will start giving you signals that labor is near. Understanding these early signs is empowering. It gives you time to prepare, make arrangements, and feel more in control. Remember, every pregnancy is unique, and labor signs can vary from woman to woman. Some women experience several pronounced signs, while others have subtler experiences. This guide is designed to help you understand the common early indicators of labor. Knowing what to expect can calm those nerves and boost your confidence as you move closer to the big day. In the upcoming sections, we'll break down each sign, explaining what to look for and what it means for your labor journey. One of the most talked about signs of labor is contractions. But how can you tell if those cramps and tightenings are the real deal or just a practice run? Understanding the difference between Braxton Hicks contractions and labor contractions is key. Think of Braxton Hicks as your body's way of warming up for the main event. These contractions are often irregular, don't increase in intensity, and might even disappear when you change positions. They are usually more of a tightening sensation than true pain. Labor contractions, on the other hand, are the real MVPs. These contractions are the driving force behind labor, helping your cervix dilate, open, and efface, thin, to prepare for childbirth. They will become increasingly regular, stronger, and longer in duration. Unlike Braxton Hicks, labor contractions don't go away with a change of scenery. If you're experiencing contractions that are growing in intensity and frequency, it's time to start timing them and contact your healthcare provider. As your due date nears, you might notice an increase in aches and pains, particularly in your lower back and abdomen. This is due to the hormonal changes happening in your body as it gears up for labor. The ligaments in your pelvis are loosening, and your baby is descending lower into your pelvis, putting pressure on surrounding nerves and muscles. Lower back pain is a common early labor sign, often described as a dull ache, or a more intense, persistent pain that wraps around the lower back and hips. This pain can be exacerbated by the weight of your baby and the increasing pressure on your spine. Cramping is another frequent visitor during early labor. You might experience period-like cramps or a feeling of intense pressure in your lower abdomen. These cramps are your uterus contracting and your cervix beginning to prepare for delivery. While some discomfort is normal in the final weeks of pregnancy, it's essential to listen to your body. If you experience severe or sudden pain, or if you're concerned about any of your symptoms, don't hesitate to contact your healthcare provider for reassurance and guidance. 4. The water breaks. What happens now? The iconic water breaking moment is often depicted dramatically in movies, but in reality, it can be a much more subtle experience. For some women, it's a sudden gush of fluid, while for others, it's a slow trickle. This happens when the amniotic sac, which cushions your baby in the womb, ruptures. If you experience a gush or trickle of fluid from your vagina, it's important to contact your healthcare provider right away, even if you're not having contractions. They will likely want to assess your situation and monitor you and your baby. Note the color, odor, and amount of fluid when your water breaks. This information can be helpful for your healthcare provider to assess the situation. In most cases, labor will begin naturally within 24 hours of your water breaking. If labor doesn't start on its own, your healthcare provider may recommend inducing labor to reduce the risk of infection. Bloody show and other pre-labor surprises. As your cervix begins to dilate and efface, you might notice a thick, jelly-like discharge tinged with blood. This is known as a bloody show and is a positive sign that your body is preparing for labor. The bloody show is a result of the mucus plug that has sealed your cervix throughout pregnancy being dislodged. This plug acts as a barrier to protect your baby from infection. As your cervix begins to open, the plug is released, resulting in the bloody show. While the bloody show can be a bit surprising, it's generally nothing to be alarmed about. However, if you experience heavy bleeding or are concerned about the amount of blood, it's always best to err on the side of caution and contact your healthcare provider. Along with the bloody show, you might notice other changes, such as increased vaginal discharge, loose bowels, or a sudden burst of energy. These changes are all part of your body's natural preparation for labor and delivery. The home stretch: dilation, pressure, and getting ready for baby. As labor progresses, your cervix will continue to dilate and efface. Dilation refers to the widening of the cervical opening, while effacement is the thinning of the cervix. Your healthcare provider will measure your cervical dilation in centimeters throughout labor. As your baby descends further into your pelvis, you'll likely feel increased pressure in your pelvic region. This pressure can feel like a heavy weight bearing down, or a strong urge to push. Let your healthcare provider know when you start feeling this pressure, as it's a sign that labor is advancing. You might also experience an increase in back pain, particularly if your baby is in a posterior position, facing your front. Applying heat, massage, or changing positions can help alleviate some of this discomfort. Remember to focus on your breathing and relaxation techniques during this time. Your body is working hard to bring your baby into the world. Every pregnancy is unique. Trust your instincts and your healthcare provider. Every pregnancy is a unique journey, and labor is no exception. While this guide provides information about common early labor signs, it's essential to remember that your experience may differ from someone else's. Trust your instincts. You know your body better than anyone. If something doesn't feel right or you're unsure about a symptom, don't hesitate to reach out to your healthcare provider for guidance and reassurance. Your healthcare provider is your trusted partner throughout your pregnancy and labor. They are there to answer your questions, address your concerns, and provide personalized care tailored to your individual needs. As you approach your due date, stay informed, listen to your body, and trust in the incredible journey of bringing your little one into the world.